Othering Podcast explores the world of marginalized communities with a focus on the disabled and LGBTQ+. In our discussions, we will provide a platform for our guests to advocate and share their stories. By delving deep into their difficulties and successes, we will explore the changes necessary to improve lives everywhere. Thank you for joining us, and welcome to the Othering Podcast with Mike and Dory.
Hello.
Hello. All right, today we are talking to Nelly. She lives with multiple rare conditions, including a genetic disorder called BMP2 dysplasia spectrum, which only about 34 people in the world are known to have. She was born with a congenital heart disease and has lifelong challenges affecting bones, joints, muscles, and digestion. Her passion is in raising awareness for diseases, and she loves interior design and color psychology, and she hopes to one day create healing spaces that support both mental and physical well-being. Welcome, Nelly.
Welcome.
Hi, thank you for having me.
Thank you for coming on and talking with us. So, first off, how did you get into deciding that you wanted to do like color therapies and things like that? What brought you to that idea?
Well, I just always have been really impacted by my surroundings. Like ever since I was younger, I was always watching interior design shows and stuff like that, and I was always making my room decorated nicely. And because I found that it really had a large impact on my mental health. I don't like everything. If I didn't have fairy lights, I would be so sad. Or if I didn't have my room a certain color, I would be sad. And so that kind of got me into it at a very young age. I always knew that I wanted to do interior decorating or interior design. And then as I got older, I kind of learned more about that and got more interested in psychology and the connection between the colors and your mental health and the effects that it has on you. And so that's where that passion lies. And also growing up chronically ill with going to hospitals, seeing the bright fluorescent lights that they use, the dark walls, it feels very much like a sad place to be. Mm-hmm. They don't use any greenery or anything like that. So from that perspective, I was I really would like to work with hospitals and change that and make them have plants, because there's so many studies on it that says that it actually improves healing, which makes sense. If you're not seeing any greenery, you're not seeing any life, and it gets really depressing and sad. And so I just really want to make a change in that. And yeah,
I think that would be excellent. I agree. Hospitals are the most depressing place in the world.
Yeah.
And it is true, because if we're there to be, getting better, to heal, it makes no sense that for the most part in a lot of areas it's just stark white. And
exactly.
Yeah, that's great so you can see blood on the walls, but it's not so great for inducing, happiness and all of those feelings that you kind of need in order to get better and to heal and to get out of the hospital.
Exactly.
So
and it's so simple. They just need to paint a wall green.
Yes.
If you can't do plants, do fake plants, anything.
Speaking of design, you also dabble in fashion, don't you? I've seen a lot of stuff on Instagram.
Yes.
Is that kind of the same idea where that came from?
Yep, the exact same. Because when I wear clothes that make me feel good, I do better and I feel better. And so that's kind of where that stemmed from.
Makes perfect sense.
It makes 100% sense, because confidence is a big thing, and when you have confidence in yourself and how you feel on the outside, it does make a difference with how you feel on the inside. And I think that fashion needs to include us more, because some of us like wearing tops that are kind of close, tighter and such, and it feels good, but at the same time it's itchy, and you get those horribly itchy fabrics because I'm always scratching. And it would be nice to have fashion that looks good but is more than just a t-shirt or a sweatshirt, and that doesn't itch.
Exactly. That's made with good material.
Yeah.
And that's made more disabled friendly. And also, disabled people are fashionable too. and it should cater to them as well.
Yes,
As
it should.
They're the largest minority, and you still look good even though like you're disabled, and some people just don't think that fashion like includes them, and I don't understand why, because we're people too.
I mean, it took until, I believe, the late 90s before they started finally realizing that women could be fashionable when they're pregnant. So, I mean,
Yeah.
if it took them that long, I'm not quite shocked that they're taking forever to realize that disabled people like to wear fashion as well.
Exactly.
So when you mentioned in your intro that you have BMP2, what is that?
So it's BMP2 dysplasia spectrum disorder is the full name, and it's caused by a mutation in the BMP2 gene. And so that causes problems like skeletal abnormalities, mutations, joint issues, congenital heart disease, scoliosis, facial and dental differences, delayed growth, and organ issues. And for me, it's impacted me mostly. Like, everybody's different because it's on a spectrum.
Mm-hmm.
So some people with it are really impacted, and some people aren't so impacted. For me, I have been severely impacted by my spine and heart and my GI tract, like insanely. And then, there's only 34 people in the world that are diagnosed with this. However, it could be more because a lot of people don't have access to genetic testing, or they just maybe don't have it as severe, and so they just think that they're fine. But yeah, it's very rare, and a lot of people don't know what it is.
Yeah,
and a lot of doctors.
Which is kind of understandable, but at the same time, not. Because, I mean, especially if you're going for skeletal issues and diseases and such, I would think that that would be one of the ones that you would know, or if you're a heart doctor, you would want to know about that type of stuff that affects, hearts and such. And the fact that there's only 34 people is really shocking.
Yeah, and there, when I first got diagnosed with it, there was only 8 people. And but my geneticist just recently told me that now the number has increased to 34 people, which is not good that more people have it, but good that it's got recognized.
Yes. And
so did that affect you more mentally, because it's like, why me? Why am I the lucky one when there's so many other people out there?
Yes, it has, but I try not to think why me, instead. I kind of switch it a little bit and think it was me because of a reason. I meant to do bring awareness, or I meant to help people in this community, instead of why me. But it does get very difficult dealing with something that's so rare that no doctor really knows about, and that people don't really know about. And so there's a lot of unknowns about the future and what exactly that means, because there's so little people diagnosed with it, let alone research on it. I think I found 2 websites and it was barely any information. So
yeah, that's ridiculous that there's so little information out there. Because I would think that as soon as the first person was diagnosed with it, you'd want to just automatically know more, because your curiosity kind of gets you, and you're like, well, what is this? Why is it?
Yeah.
And what's going on? And and I understand that it's kind of hard when you need money to do those types of things, but it just seems like somebody would have been interested more than just 2 people.
Sometimes it seems like in that field, if there's not enough people, they
don't care.
Yeah,
right.
And
exactly.
That's bullshit. Sorry, pardon my French and all that stuff, but it is bullshit. Because just because only 2 people in the world have it, or 100 billion people in the world have it, you should still study it, because somebody suffers from it.
Exactly. And there's so many people in the world. I'm sure there's a lot more that suffer from it that just don't know that they have it.
Right. And it's also because it's really hard to get access to genetic testing. Unless those things are just you can't ignore them, they don't even bother with you.
Yeah.
I mean, I had to fight to get genetic testing to make sure that I wasn't going to have breast cancer because my mom has it and cancer runs in my family. And I would think that you would want to know these things, even as an insurer. You want to know, okay, what am I dealing with this person?
Exactly. Yeah.
So what sort of treatment do you get to help, or is there anything? Have you had surgeries because of it?
Yeah. I've had to have surgery. So I was born with congenital heart disease. And then from there, they saw like a bunch of mutations, like my pinkies are curved, one toenail didn't grow, and then like just little things like that, inverted chest. And so I had to get open heart surgery when I was 8 months old. And then I've had to get so many dental surgeries and dental work, which was so very expensive.
Yes.
Years and years, and I'm still going through it. Like I'm still having to get, because my mouth is like halfway, like it closes halfway and the other part doesn't close fully, so I have to get orthotics. And then I've had to get like my teeth pulled up forward because it causes like crowding in your teeth is one of them, and a lot of dental abnormalities. And I've had to get multiple scoliosis surgeries, which failed scoliosis surgeries. Yeah, and then I'm waiting to get a GJ tube, so I have to get that surgery, and then I'm also waiting to get a nerve blocker surgery. So there's a lot of surgeries with it.
Yeah. So you said failed scoliosis surgeries. Was that by any fault of the doctor, or is that just the surgery is kind of a hit or miss?
Well, it was, so when I was 12 is when I first got diagnosed with scoliosis, and I had like an 80-degree curve, and so they really, really had to operate on me immediately. So I got like jumped up from people, but because of my genetic condition, I've always been super short stature and very tiny. And so when I was 12, I was even more tiny. I was definitely not full grown. And so, but because I had to get the surgery because of the, condition, it was crushing my lungs and stuff, it was a success, and it really helped until I kept growing. And then when I was in high school, I was like my back was so bad, but it took years and years to get actually another x-ray, which I thought was crazy because I don't know why orthopedics wouldn't have given me x-rays, especially when I was complaining. But so it was 2018, and so I think it was this orthopedics fault not to give me x-rays and stuff like that is why it got so bad. But then COVID pushed the surgery because they were going to go and revise the bottom part of my spine where I grew, and then it curved a bunch. And because COVID came, I just got to a point physically where I could not walk on my own. Like I was having to have a rollator. A walker. I don't know why I'm forgetting how to say that. But I had to have a walker, and I just could not barely get down the hallway of my house. And so then eventually when they did get to do the surgery, it got pushed from it was supposed to be 2018 to 2019, and it got pushed all the way to 2022. Jeez. And so when they did that, I woke up screaming in pain, saying, my leg, something's wrong with my leg. And nobody would listen. They wouldn't believe me. They were just like, you're being dramatic, here's more pain medication. But I wasn't complaining about my back. And if someone's got a back surgery, it is so painful. And if you're not complaining about your back and you're complaining about your leg, something's not right. I couldn't move it. And so I was in the hospital for 2 weeks. They just kept playing around with the pain medication, but nothing was helping. And so then they sent me home, which I was 3 hours away, and where I was bedridden for about 7 to 9 months.
Wow.
And my physio was sending them paperwork, faxing them, telling them my patient, you really need to see my patient, something's clearly wrong. And I was calling them every single day. Nobody would answer at the hospital, and I couldn't just drive down there because it was 3 hours away. Where was I going to stay? And I couldn't sit upright for that long. And so then when I eventually got there at 7 months or 7 or 9 months later for that initial appointment after the surgery, they saw me and they're like, "Oh, something is wrong." And I was like, "Yeah."
Wow.
I told you that before.
Yeah.
Right. And then so they kept me there. They're, "Hey, don't go home. We're going to do emergency surgery because we think that maybe 2 of the screws on the bottom left are hitting too far and they're hurting, like pressing on your sciatic nerve." So they did the surgery, and it did help a little bit. Then they sent me home, and then through physio, I've gotten a little bit better. But now it's, like that was a couple years ago now, and I've been just waiting on wait lists to see a neurosurgeon, which I finally got to see just recently, and they told me that I could do a nerve blocker. Oh, actually, I'm forgetting a part of the story though. So after that, then because I had that. Sorry, my brain fog is.
No, you're fine.
I was trying to think. So yeah, I had the revision surgery, and then I think that was the only revision surgery that I had. They didn't know whether they were going to have to operate. And then from the neurosurgeon and also not a neurosurgeon, neurologist and a neurosurgeon both told me that because I have so much instruments inside my back, like my whole entire back is fused to as far as it can go down.
Jeez.
And because of that, I don't have much room. And also one of the joints is becoming, because of where the 2 screws were taken out now, there's an imbalance in my spine. And so one of them is really, the joint is just moving, whereas the other side, it's not moving. And so it's creating large amounts of pain. And then my top back, where one of the screws were in a little too far from when I was 12, that one, they think now from this new surgeries that I had, it kind of moved things around a little bit. And so they think that is pushing in too far. So each time I move, it hits or gets very close to my spinal cord, which is so painful. And so I'm really hoping that this nerve blocker helps, because this is like my last hope. Because if they do a surgery, then that they won't do a surgery because it'll have a very large increase in spinal liquid fluid and all that stuff. And they said that I'm going to be in worse shape than I am in now. And so I'm like, okay, maybe I won't do that then, because I don't want to be worse than I am, because it's already pretty bad.
Yeah, you don't want to be worse, but it's ridiculous that they didn't listen to you from the first get-go. I mean, anybody, if somebody wakes up screaming, even if it's from the surgery,
Exactly.
you still should be like, let's check this out. Let's see what's going on.
Yeah.
Yes, and I asked them so many times for an MRI, and they didn't give me one until 2 years later, and it wasn't even my doctor who ordered it. And I was like, thank God somebody cares and listens. And then it took years to actually get a referral to a neurosurgeon. And so thank God this new adult orthopedic that I got sent to, he was so nice, and he's the one who sent me to the neurosurgeon, which if you get referred by a surgeon, you get in super quickly, and they're only taking referrals from 2021. And so I got in very quickly, which I'm so thankful for that.
Yeah. I mean, that's ridiculous that you have to go through that in order to even get any semblance of help. And those good doctors that do listen are too far and few to find in order to get the help that you need.
Exactly.
And it's just like my journey going through trying to get my diagnosis. I went to an ortho, and he's just like, well, walk it off. It's like, wow, thank you. And I kind of listened to him, and I did, and it ended up getting worse because I walked it off. And you shouldn't just dismiss people, even if you can't see it, just because there's no broken bones, or just because there's, things not sticking out of the body that aren't supposed to stick out. Doesn't mean that we're just faking it, or that we want, excuse me, that we want medicines or something like that. It could honestly be that we are in pain. Yeah,
that something is wrong.
yeah. God forbid we actually know our bodies.
Yeah, God forbid we listen to our bodies.
Yeah, and they always say you should, you know yourself better than anybody. Well, I know myself. I know I'm in pain, so why don't you listen? Oh, no, you're wrong. You can't possibly be in pain, and it's frustrating.
It is, yeah.
You shouldn't have to fight both the doctor and insurance to get anything done. And I'm glad that insurance wasn't trying to like say, oh no, you don't need this or things like that, because it happens a lot here in America where people need like breast surgery for metastatic breast cancer, and then the insurance calls and says, nah, you don't need it. And it's like, wow, really?
For the listener, you're in Canada, right?
Yeah, that's
Yeah.
like, to me, that's mind-blowing, because like, how could an insurance company override what a doctor said?
Yeah,
Like,
they do it a lot.
Yeah.
And it's sad. I mean, like in America, about 34,000 people die because they can't get access. Not because they don't have insurance, but because they can't get access.
That's just insane to me.
It is. It's completely insane.
It's a system that's built against people.
Yeah.
But it sounds like, and correct me if I'm wrong, it sounds like there's a lot of extremely long wait times for you, even though you don't have insurance, which is great, but you still can't be seen for 9 months.
That's the thing with Canada's healthcare. It's like, okay, yeah, like I'm approved, I don't need to go through insurance to get a surgery or something like that, or pay large amounts to get a surgery unless I'm going through private healthcare. Right. But the trade-off for us is that the wait time, it's like years and years, especially if you want a family doctor. And especially if you live in like Atlantic Canada, which is where I do, and the wait time is even worse because it's so small. There's so little access to doctors, and I think that the doctors can't send you in for a test. They have a certain amount that they can send people, like a certain number, and so that's why I was reading that they can't send you for like all the MRI or whatever, and it's like, I just don't get it. But yeah, you're guaranteed to wait years and years.
But that's ridiculous.
Yeah, that's crazy.
Yeah, and it's like, it only seems to be getting worse. So,
I mean, you would think that since around 1900 to 1915, most countries started doing insurance stuff. Yeah. That's when a lot of the other countries started doing universal health care. And that's a whole other reason why we don't have it. And it has to do with skin color because of racism. But it's still, you'd think that after 100 years, we would find some way to be able to make people get the health care they need.
Yeah, exactly.
So it sounds like you haven't had a great support through the medical field. Did you have a lot of support at home, personal, with family or friends?
Well, growing up, I never told anybody about my health conditions. But honestly, like because I grew up knowing that I obviously had health condition problems, and I would just kind of go to the doctor. Like ever since I was born, I was followed by a family or like a children's hospital, and I would go to my appointments. Then I'd go home and I'd pretend it wasn't there. But I also grew up with a lot of abuse, and so that was very much on the neglected and kind of pushed aside and on the back burner. And so I would just follow suit and I would do the exact same. And so I also thought that if I say that I don't have it, then it won't be true. Then I won't have it. And I had this idea that, oh, when I get older, like when I'm 18, like I'll be good, like I'll be cured or whatever. And I was also ashamed of it as well, because you grow up and you see people who are different and who are visibly like disabled, and you can see that they use mobility aids, and you can see growing up in school the kids aren't nice to them, they're not inclusive to them, so you're like, okay, well, I know, I'm kind of almost being taught that you're different and that's not a good thing. And so I never would tell anybody until I got into my like second year of college, I think it was, because that's when it really became noticeable and I kind of had to tell people. But also I started doing research, and I didn't know that it was called a chronic illness growing up, I didn't know very much about it, and there was honestly like no research that anybody told me, my geneticist or anything. They told me the name of it, and that was it basically. They did the genetic testing, gave me the diagnosis, but told me like, look out for these types of things, and sure enough they would happen, but they didn't tell me anything really else about it. And I also, I didn't know it was called a chronic illness. I thought only chronic illnesses were cancer and stuff until I got into my first or second year of university. And I was searching it up, and I saw that people, like, chronic illness was beside it, and I was like, oh. And then I did more research, and then I became a part of the chronic illness community. I found that, and I was like, oh my god, look at all of these people, like, they're just like me, like, I didn't know that they existed, and it's called a chronic illness, and other people have this things. And then I started embracing it more and being more comfortable with it, and then I started getting more diagnoses because I've been more vocal to doctors, and so now I have a very large pile of diagnoses, but they're all traced back to my genetic condition. But had I known that information, growing up, it would have made things a lot more easier.
Yeah. I would imagine that it would have been a great relief to understand, what was going on and how it impacted certain things, and maybe even prevented certain things type of thing. Not to say that you did anything wrong, but it's on the doctors. They should explain these things to you.
Yeah.
And I didn't realize that there were so many different chronic illnesses and diseases until I was an adult myself, because they never say anything about any of this.
No, they don't, and I don't know why. And then growing up, like, my family members, it would have been good for them to know as well, because they just thought that I was, like, growing up, that I was selfish because I wanted that, if I saw a chair, I went for it because I had to, because it was survival for my body. I didn't understand why I was doing it, but I knew that I was tired. I was having a hard time standing and stuff, but they just, kind of thought that I was, like, my siblings thought I was selfish for it. And then not getting the support that I desperately needed, like, for gym class, for example, I would go to gym classes, and it would be so hard. I would sneak out, go to the bathroom, and stay there for, like, the whole period, because I would be in so much pain. I didn't realize that there was accommodations for me, and I would be writing, and it would be so painful to write, even, like, in college. I didn't realize that there was accommodations, like a note taker and stuff like that. And it would have been really nice to know those things growing up, because then a lot of things would be preventable, and you wouldn't get worse before you got better. So.
And it also helps with, mental health. If you had those ideas and understanding, then, other people wouldn't be so quick to say, oh, you're being selfish for stealing the chair. It would also help academically, because then you'd know, oh, well, if your hand hurts from writing, then if you have a note taker, then you can get help that way. And it makes it so much better when you have those constructs to use and know you can use them, than thinking, well, maybe there's something wrong with me, or I'm not quite sure what to do. And then it kind of, as for lack of a better way to put it, we let too many people fall through the cracks because we don't know what they're going through. They don't know sometimes. And instead of, reaching out and saying, look, I'm seeing you struggle. Let me help you. Or is there some way I can help?
And I think we've said it every episode, but the community you mentioned on Instagram, I think that's a huge thing. I mean, it's the nicest people in the world, for one. I'm not really a part of the disabled community, and I love the group. And like you guys are talking about, just knowing there's other people like you, and knowing you can get help from someone that has similar issues or a similar condition, that's huge. Even though social media can suck at times too. I think that's very helpful. And that's also why we wanted to do this.
And I think that's one of the few good things that came out of social media, was being able to find so many people that, unfortunately, we have to suffer. And I hate the fact that that's what brought us together. But at the same time, it's one of those things, like, I wouldn't have met some of the best people in the world if I didn't have to suffer. And it
helps the suffering.
Yes, it helps to know.
It helps make it better.
And and I hate saying I'm glad that we have to suffer in order to meet, but because I don't. We shouldn't have to suffer to meet, but at the same time, I'm glad we all have something so that we can get together and
You have
not
something
only
in common.
yeah, not only something in common, but just when you get your diagnoses. And at first, like for me, I felt so alone, so isolated, and like I had never heard of CRPS before. I didn't know anything about it, never saw it on TV. Nobody talks about it when they get, these illnesses. And so I was just sitting in pain, a lot of pain, and going through doctors and nurses and trying to figure out what was wrong. And then even after I figured it out, it was still, I felt alone. And then when I got on to Instagram and started finding other people that were ambulatory or not ambulatory and all of these different people, it was just like, I'm not alone.
So you made me think of a question for both of you.
Go ahead.
When you got the diagnosis, you said you didn't know much about it, and I'm guessing you didn't either, Nelly.
No.
So the doctors just kind of give it to you, say you've got this, and send you home. Do you think that they should spend more time with you discussing what the illness or ailment is and explain it to you better?
Yes, definitely. Because
100%.
cancer patients, when they get their cancer diagnosis, the doctors sit with them. They hold their hand and they say, look, this is what you have. This is what can happen, but this is what we're going to do. Mm-hmm. And I think everybody should be afforded that same level of care, even if it isn't terminal. We're still human.
Exactly. I find too many doctors, they give you a diagnosis, they shove medication in your face that make you worse half the time, and send you on your own, or they don't do anything and they just say, bye, you're too complicated, you, either don't refer you to somebody, or they just drop you.
They just send you to somebody else that's going to do the same thing, and you're going to go through the cycle over and over again.
And
it's hope that maybe one doctor will actually listen, take their time with you and help you.
And that's the part of the problem too, is that they hear us asking for help, and they're just like, well, I don't know what to do, so I'm not going to do anything. It's okay to say, I don't know.
Yes.
And then say, look, let's help you figure out somewhere you can go. Let's, work together to find a specialist that might, know what you're going through and understand and be able to help you, instead of saying,
Yeah.
Yeah, and I find so many doctors, or so many in my situation, like they've been like, oh, you poor thing, sucks, and then they don't do anything to help at all. And I'm like, well, okay, so you don't know what to do, but you're not going to send me to somebody? We're just going to both sit here and not know what to do?
Yeah.
I find it so many times that happens, and I'm just mind blown.
Yeah, it is mind blowing.
Do they offer you any sort of pain medications to help?
I mean, my pain specialist, we've tried so many different injections, so many different medications, and I'm on so many different medications, which I absolutely hate the side effects.
Yeah.
And I blame a lot of them on getting my GI system worse.
Mm-hmm.
Because, there's really treatment plan for, BMP2 dysplasia spectrum. Mm-hmm. So I just kind of have to treat, I guess, each illness that it gives you, but there's not a whole lot of options for all my other illnesses, but I've tried so many and none of them have really helped, especially with the pain.
That's the other thing, is that I would think that they would want to research more, because treating each symptom instead of treating the whole doesn't help.
Exactly.
And a lot of times it just makes it worse. Like you said, I have to take gabapentin. That is created for epileptics. Yeah. I am not epileptic. There's nothing wrong with being epileptic. I'm just not epileptic. And so taking a medicine that's for them just seems like it's kind of strange. And the fact that they won't even try to research a drug or something, some sort of treatment that would work for chronic pain people.
Because doctors, they're trained based off of to fix the symptoms, not the root cause. And it's so frustrating because you don't actually you can't really give yourself really great help if you don't get to the root cause.
Right.
And you're
Right.
just treating the symptoms, because there's so many overlapping symptoms that go with so many different conditions, and like, and a lot of the time they're just like, oh, this medication, there you go, try it.
Yep.
And it's like, okay, they don't even tell you the side effects.
No.
Ever. They never tell me the side effects. I ask them, and they just say, list 2 side effects. Might be a little nauseous, maybe a little dizzy, and that's it.
That seems to be what they say for every medication.
Yeah.
Nausea, lightheadedness, and maybe get tired.
Yeah. Or my favorite ones are the ones that are supposed to keep you alive, may cause death. It's like, wait a minute, what?
Yeah.
It's like, wait, what? I can die without it, but I can die with it. Awesome.
Like on those ads on TV,
Yes.
I always laugh. They list a million side effects, and then the last one, death.
Yeah.
Possible death. And they're like, but buy me.
Yeah. And the people are always happy. It's like, who the hell is happy that they have these issues? And, like, even the venereal diseases like herpes. I mean, people are, like, holding hands and smiling. It's like, no, you don't understand.
Yeah.
These are ridiculous. And you mentioned that your family wasn't very supportive. The people that you are with now, like family and friends, are they supportive now? Are they helpful? And do they understand better now that you know more?
Yes. Now that I know more, now that I've since I started being more vocal about it a couple of years ago, my family started understanding more, and it took a lot for my siblings to understand, because they just wouldn't really see me, because I moved out when I was 18 and never moved back until a couple of years ago when I had to, because I just got worse, and I moved back with my mom, and my mom's always been super great and understanding and very accommodating, very good support system there. But yeah, and then my siblings they've grown to, they've kind of seen me more, like they've seen the ambulance have to get called, and they've seen that more firsthand since I had to move back with my mom and my siblings. But now I'm living with my boyfriend, and he's super sweet, so accommodating, so supportive, and really helpful, which is really nice. And then my friends, they're all super supportive and nice. I don't have too many of them, but the ones that I do have are great. So I'm really happy about that. I don't get to see them often though, because we live in different cities a lot, and also I've just been so malnourished and unhealthy and just weak, and I haven't really been able to have the strength to go see them, or to even have them over at my place. But yeah,
Good.
A lot more support.
Good. I'm
That's
glad.
good.
And I want to also kind of talk about your boyfriend a little. I think that's an important aspect that we should also talk about. That even though we have issues, problems, diagnoses up the wazoo that, kind of lead into others, or we're still worthy of love.
Yeah, and that took me a long time to learn, because I did not think, growing up, I did not at all think that, and then that got me in a lot of abusive relationships, which only made my health-wise just deteriorate like crazy, because when you're taught, basically through society, that you're unlovable, because a lot of people think that people with chronic illnesses or health issues or disabilities are not worthy of love, what you said, and it's not true, but you grow up kind of believing that, because that's what society's throwing at you.
Right.
And I think a lot of people need to know that, no, you're not unlovable. You're a person, and people love you despite anything. No matter what, everybody has problems and things that they go through in life, and yours, there might be more serious than someone else's, perhaps, but they don't make you unworthy of love.
Right.
As a caretaker, I can admit it's scary watching someone you love, I guess you could say, deteriorate and have the problems, and watch them in pain. But if you love them, I mean, so what? You help them out and you get them through it. And I think that us good people that do that, like your boyfriend, me, and several others that we've talked to, they understand that it's not about what's wrong with you, it's just about you.
Yeah.
You're a person and you're beautiful inside and out, regardless of what's wrong with you.
Yeah, I mean, when you're beautiful inside, it just radiates.
Exactly.
And
it just radiates.
Yeah, and it doesn't matter what you look like. It doesn't matter how tall or short or whatever it is. You're worthy of love. And, even shitty people deserve some love, but but if you're disabled or you have chronic illnesses, anything, don't ever think that you don't deserve a good person to be in your life.
Exactly, and everybody has one thing in common, and that is that we crave love and we like to give love.
Yeah.
And even though there's a lot of hateful people out there, there's so many nice people, and I find it's for me anyways, it's once I kind of broke through that, and On This Community is a really good example. It's whoa, there's a whole different world I didn't realize, because I was hanging out with people who partied. I was with people that didn't have good intentions, and I just maybe bad people. But once you make it out of that side and you actually find genuine people, it's the light brightens and you're able to see the world being wow, the world is not all evil. There is a lot of good in the world, and a lot of good people who just like you because you're funny and because you're you, and not because of anything else.
Because all that matters is what's in your heart and your brain. And the rest, I mean, it's just, that's the main part. Everything else will, fall into place a lot of times. And it's not to say that it has to be romantic love either. It can just be platonic love. It could be, friends. Everybody deserves at least one person that's in their corner.
Exactly. And there's always going to be at least one person in your corner.
Right.
Or
more, but at least one.
Definitely. And the thing is that don't think that when people are constantly, saying to you, well, why can't you do this, or why can't you do that because so-and-so can do it, or, there's, I think her name is Katie Ledecky. She's an Olympic swimmer. And she has articles about how she overcomes her disabilities.
Yeah.
And I want to say that there's nothing to overcome. It's just we're people.
It just is.
Yeah, it just is. And I'm proud of her. Go Katie Ledecky, bust ass in the Olympics. But that shouldn't be the criteria for the rest of us either.
Exactly.
So you had mentioned something earlier that triggered this question. But growing up and kind of through your life, you've had a lot of issues kind of getting support and stuff. And now you have it. Do you find it's hard to ask for help? And kind of how did you get to a point where you could ask, especially your boyfriend, people who are always with you, ask them for help?
It's hard, and I still don't like it, but I think that it's being kind to yourself, and I've kind of learned that, okay, if I don't ask them to pick something up for me, if I drop it on the ground because I can't bend, and if I do, it's well, I can't bend my spine at all, but if I try to, go and bend down so I can still get something off the ground if I really needed to, it really hurts, terribly badly, and so I kind of just have to be okay, I'll be better if I just ask them. But I still have to, I still go, oh, sorry, I don't mean to ask you this. Sorry, I know I'm asking a lot. Stuff like that, because it's just...
Yes, that's the other thing.
A habit.
Do you find that you say sorry a lot? Because I still constantly say, oh, I'm so sorry, can you do this for me? Or I'm sorry, I don't mean to be a burden, even though we're not burdens. And it's one of those things you're not, but you can't get your head to not think of it at the same time.
And my boyfriend, he helps me with that because he's stop saying sorry. Don't say sorry. I'd rather you not in large amount. I'd rather your pain not to be a 10. It's so easy for me to do, but not for you. So don't worry about it. And that helps me a lot because I'm just okay, yes. But I still have to be don't say sorry. Don't say sorry.
Yep.
I'm the same way with Dory. I stop her from doing stuff because it's not worth the next 3 days being down and out because she did one little thing that was easy for me to do.
Yeah.
that would have saved her a whole lot of pain and trouble over the next week.
But it's hard because, again, going back to society, no matter where you live, it's always, your worth is tied to how much you can do individually.
Yep.
Yes, and then when you're dating somebody, even though, like, you could be with them for years and years, but in the back of your mind, it's always like, am I too much? But, like, am I too much work?
Yeah.
Like
I mean,
it's like,
Mike and I just celebrated our 25th wedding anniversary.
congratulations.
Thank you.
Thank you.
And I still have that in the back of my head. I've been diagnosed since 2015. I've been having issues since about 2010, 2012. And that whole time I've constantly been like, but I'm supposed to be able to take care of myself because, I'm an adult, and that's the the goals that we're supposed to have as kids, right? That we get to be independent, and I get to stay up, and I get to make all the rules.
Late.
Yeah, go out late, and then you realize that it's not worth it. But at the same time, you can't stop yourself because that's what society tells you is supposed to be fun or what you're supposed to do.
Exactly, yeah.
Especially being female.
Yeah.
We're really told we're supposed to give so much and give.
Yeah, you're supposed to be there for everybody, but not for yourself. And that's why so many women, like, have autoimmune disorders, because, like, they're always putting everybody else before them.
Right.
And so it's really hard to unlearn that, especially if you've grown up with abuse, because you're told that from society and your family. And possibly your friends, depending on your school life and stuff. But, yeah, so it's very hard unlearning it. But I'm, like, trying to just affirmations each day.
Yes. And I keep sending, my daughter things like don't rely on everybody, but at the same time rely on those that are truly your friends. And it's just, I'm constantly sending those things to her because I want her to understand what I didn't understand growing up, which is, and back to your talking about how so many women have autoimmune disorders. And it's also partially because not only are we taking care of everybody else instead of ourselves, but we ignore those signs that say something's wrong because you're supposed to,
And then doctors also, when you're a woman, they typically don't take you as seriously. And so that's a part of it too. And it's like, so it's
it's like, I think the percentage is about between men and women, and it's not to say that men are always 100% taken seriously either, especially when it comes to pain. But on average, I think it's like 20 to 40% longer for a woman to get taken seriously over a man. And that's just ridiculous.
It is.
Do you see a difference if your boyfriend goes with you to a doctor?
Well, he works a lot, so I normally go to my appointments alone, unless it's like a super important one. But I actually have not noticed a difference.
Okay, that's good.
I actually, for my pain specialist, for whatever reason, but it's different each day with him, I find. It's sometimes he takes me seriously and sometimes he doesn't quite take me seriously. But one time when my boyfriend went, he kind of just shut down everything and didn't take me very seriously. But then when my boyfriend wasn't there, he actually took me seriously and, like, made a referral and helped.
That's weird.
So I don't know. But my endocrinologist, it's hard to say, but he's just a really good doctor, so I don't know if that is because my boyfriend's present or not. I don't really think so, because even when I spoke to him alone, he didn't. But yeah, I haven't noticed a difference. But I noticed, like, a lot online, people say that, especially if he shows up in a suit.
Yes. Yes. And I hate to say it, but I've noticed a difference in certain doctors that when I'm alone versus when I'm with my mother or when I'm with Mike. When I'm with my mother, they treat me, they take me more seriously. And when I'm with Mike, they seem to listen better. But when I'm alone, it's like, sure. And then it kind of goes on.
I guess my mom has taken me to a lot of appointments, and it has been like that as well. Just, like, haven't noticed a difference with my boyfriend, like, because he hasn't. They went to I have so many doctors, so like some of them went to these ones, some of them go to this one, whichever
Yes.
one's available.
Yeah.
Or it's myself, but most often it's myself because they both work a lot and long hours. And but yeah, like hire like surgeons, stuff like that. If I'm alone, they don't take me seriously in the slightest. People like that.
I've also found, like, especially in the emergency rooms, if you're in there complaining of pain, a lot of times they kind of look towards the husband as maybe, or the guy, whoever's with you, as maybe the one that caused the pain that's doing it. So it's like the doctor doesn't want to talk and they shut down because they're afraid that you'll say that you're the problem.
I think it's a little...
It's funny that you say that because I was in the ER at a hospital not too long ago, and I was with like Mo, my boyfriend, and my boyfriend, like, he asked him to go see something because he was in the ER too for something, and so he asked him to leave the room for a second, and then when he left, the doctor said so how long have you been dating him? And just started asking me questions like that, as it like kind of implying that like he wasn't good or something like that.
Yeah.
I was like, oh my god. And that was like the only time that something like that happened. But
And I get why they have to do it, because sometimes people are terrified to say something. And I hate the fact that we've gotten to a point of where people are terrified to say something, because they should. If you're in a situation like that, find somebody to talk to.
yeah,
And at the same time, though, it's like being on the female end, though, it kind of feels like a little bit of, they're looking to Mike as, did you cause this? And at the same time, is she serious? Or is this just kind of in her head type of thing?
is this a regular occurrence?
Yeah. Like, is she nuts? Do we need to get out the white jacket and some syringes? And it kind of feels like it's a little bit of both. Like, they're trying to figure out which way they need to hedge their bets.
Depending on which doctor, too. It's like,
Yeah. And I found that, like, do you find that female doctors are better or male doctors?
I've had mostly male doctors. I've only had a couple of female doctors. It's hard to say because I've only had like maybe 4 female doctors, and the majority of them have been men. But yeah, I don't know. What about you?
I would say that, I know this sounds like a cop-out, but it depends on what it is. For, like, pain, it seems that male doctors seem to be a little better usually, but when, and like, endometriosis or things like that, men doctors seem to listen better. But when it comes to, like, my CRPS and things like that, women doctors seem to be better. And it's weird because statistics show that female doctors have better outcomes, but yet a lot of times I've felt more comfortable with the male doctors, and not because there's this a bias going through my head saying, oh, he's a man, he must be better. No. It just depends on what the specialty is. But for the most part, I feel more comfortable with them because I found that a lot of times the female doctors make me feel like they're judging me over it more. Like, well, why didn't you say something sooner? Or why didn't you do something? And, it's like, but it was out of my hand kind of thing.
Yeah.
So
That's funny because I prefer female doctors. And I wonder if it has to do with, because you're the same gender, it's almost like like a competition type of thing.
Yes.
yes.
That's a good point because women are, like, society's taught women to kind of compete with each other. So that makes a lot of sense.
That does make a lot of sense. Because
I do feel more comfortable with men doctors, too.
I feel like I can say more to them and not feel like, I mean, I'm sure they judge me too, but it doesn't feel the same level of judgment as when, like, certain female doctors, because it's like, you should understand you're a woman, damn it. And it's almost as if they don't want to.
And I find, I will say, like, in ER situations, I always thought in the past that I was like, oh my god, yes, when I saw a girl, female doctor, but now I don't. Especially, I should say triage doctors. I find they are the most understanding, and they're always, like, females. I find, and they don't. I haven't gotten good feels with them. They kind of just very dismissal and kind of like
Yes.
almost rude.
Yeah.
That's what I found like in ER situations.
They're trying to push you through too fast. They're not
Yeah.
worrying about the real problem. They're just trying to get you in and out.
They're not even worried about a problem usually, unless you're like,
Dying.
yeah, unless your eyeballs are hanging outside of your face type of thing where it's not normal. They don't seem to care.
Yeah. And I wonder if it's like, oh, like because we're so used to pain as women, they're just like, oh, well,
Tough it up.
I can handle a hard period, can't you? Type thing, and it's like,
I do think it kind of does that because I have found that growing up, I have had excruciating periods. They were awful. And the only people that understood it were other women that had excruciating periods. The ones that didn't were just like, you're just, over exaggerating. Yeah, you're being dramatic. It's not that bad. And I mean, these are people who've never like had a twinge in their life. And it's like, shut up.
yeah.
And I think part of that is also because society tells us we gotta compete for quote unquote scarce resources that really aren't scarce.
Yeah.
And I think that also plays into disabled areas too, because then if you've got your own sex saying, oh, it's not that bad.
Yeah.
You got to figure then the opposite sex is going to be like, it's not that bad. Because, my mom didn't go through this, or my ex-girlfriend, or whatever it is, didn't go through this, and they were fine, so you should be okay. And so it perpetuates the idea of then we as women assigned female at birth and those that are trans women have to just suck it up.
Yeah, exactly.
And studies recently have found that by sucking it up, it ends up causing more health problems. So it's just a vicious cycle.
Because you're ignoring the root cause.
Yeah, exactly. That's what I did, and like I got so much worse in every single condition that I had. And
I do that too. I still have to catch myself and, not ghost myself, but what is the word?
Gaslight.
Yes, thank you. Yeah, definitely not ghost. I can't ghost myself. I'm not going to answer myself, but no.
Not today.
Yes, I'll talk to myself tomorrow. But I find that I still gaslight myself a lot, where it's like, oh, no, it must be in my head. And I'll try and do something that I know is stupid, but I can't help it because it's like, I keep thinking, oh, it must be in my head. This can't be real. And then, you go out and you read articles or things like that, and everybody's like, oh, well, it's not real. It's in your head, unless you have a genetic marker. And
even then, so many doctors are like, oh,
but
do you actually have the testing? Or like, I don't know your condition and stuff like that.
Yeah, because like malignant hyperthermia runs in my family.
Yeah.
And there's genetic testing for it, but the best genetic testing is in Canada.
Yeah.
And that is the only test that actually will tell you for real if you have it or not. The tests that we have in America can be false positive or false negative. So
for the listener, malignant hypothermia is allergy?
It's kind of it's like having an allergy to specific inhaled hydrogen-based analgesics.
The stuff they use to put you to sleep, right?
Yes.
Yeah.
And so...
and not put you to sleep like a dog.
Oh,
put
no,
you
no,
to
no,
sleep
no.
for surgery.
I mean, they do use the same things to put people to sleep for like a dog, but they don't use the same amount. And so my family has to be careful about that. And I'll have doctors, are you sure you know what you're talking about? Yeah, my grandmother died from it. I know what I'm talking about. My family has had issues with it. My aunt, my cousins. And it's just, why can't they just take our word for it sometimes?
Or look in your files and see.
A little bit of empathy goes a long way.
Yeah.
Exactly.
And I get that there are some people out there that truly do, come up with shit so that they can get medications or things like that. But you shouldn't assume that all people that come across you.
Exactly. And like the percentage of people that actually do that is so low compared to like someone actually having like an issue that they just need help.
Yep.
Yeah.
Well, this hour went really, really fast.
Yes,
it did.
Thank you so much for talking
about
with
at
us.
the end here. Thank you so much.
Thank you for having me.
And we hope to have you again. And we would love to talk more about like fashion and your design and things like that. And maybe we can get you to virtually design our color in our house and things like that.
That would be fun.
I hope you can figure something out to manage your pain.
Yes.
It's just heartbreaking to hear about that, and no one should have to go through that. I'm so sorry.
Please keep us posted on that too.
Yes, I will.
Because nobody should have to suffer through pain. Nobody shouldn't be believed. And it's just, we need to find a way to stop the vicious cycle of constantly being told it's in our head or there's nothing wrong when obviously there is. Because if people are saying my body is falling apart and just because there's nothing visual doesn't mean it's not happening.
Yes, and pain management is suicide prevention.
Yes.
So,
And a quick anecdote about that, the CRPS that I have is considered one of the top suicide diseases.
yeah, which is, isn't that the number one painful?
Yep, it's the most, it's considered the most painful, like 10 times worse than getting shot or your back severed and, things like that. And, and
Horrible.
yeah, it's really horrible. And to think that you can't be believed.
Yeah.
And then they wonder why there's so many people that kill themselves over it. Because I bet you a lot of them had to fight so hard.
That's a very pleasant way to end this episode.
All right, well, let me end on a happy note. Don't kill yourself. You are worth it.
All right. Thank you again.
Thank you.
Bye.
Bye-bye. If you've made it this far, thank you so much for listening. Please leave a rating for us wherever you listen. Follow us on Instagram and TikTok.
Othering Podcast is brought to you by Loudcore Productions in conjunction with your support. Your host, Mike and Dory Morris, graphics by Joshua Morris, and join us next week on the Othering Podcast.